I am Larry Kraiss, Professor of Vascular Surgery with University of Utah Health. Go Utes. My initial interest in medicine was actually Chad Everett on the TV show Medical Center. And I thought it was so cool that he was in the operating room, and then there was the classic nurse mop my brow sort of thing. And then I took a high school physiology course, and during that physiology course they showed open heart surgery. And I would just, the hook deepened. I mean, they just really set the hook at that point. The whole reason to be a physician is to take care of patients and to never lose sight of the individual who's in front of you, who's a patient, and who may have no knowledge of what's wrong with them. And it's my role to not only take care of them, but to explain to them as best I can what's wrong with them so they have a better understanding of why they have to undergo what I'm recommending. We began to realize that we were receiving lots of emergency patients in the University of Utah emergency room from outlying hospitals and towns. And we said, if we'd only known about this condition earlier, we could have prevented this emergency. And we began to look around for opportunities and frankly hospitals or interested towns that would be interested in having us come. By that time we were going to Memorial Hospital in Rock Springs, we were going to Evanston Regional Hospital, we were going to Uinta Basin Medical Center in Roosevelt, and then most recently 4 or 5 years ago we started going to Elko. Their referring physician can send them to see us there, and we can reassure them that, well, the situation you've got right now is not all that serious, or it's potentially serious, but we don't have to do anything about it now. It needs follow-up. And then they say, well, does that mean I have to travel? I've summarized it for patients a number of times by saying it makes a whole lot more sense for one person to travel 200 miles to see 10 patients than it does for 10 people to travel 200 miles to see one person. I have personally benefited from going to these places too. I feel like I have a better understanding of how my patients live than I would get if I saw them coming to see me in a big university clinic. And I get a better idea of, what life is like for them when I see them in their hometown. It's really a unique ability among surgeons to have a lifelong relationship with their patients, a lifelong longitudinal relationship with patients. And that's the sort of thing that has been also very rewarding. I can't imagine having been a physician without being a vascular surgeon.